I want to introduce you to Dr. Jeffrey Dietrich. He is a board-certified allergist and immunologist with Roper St. Francis Healthcare. It is great to have you here. So many things to talk about on this topic. First, I just want to begin with, does the average person have a good understanding of what food allergy is?
Yeah, unfortunately, Angela, there are a lot of misunderstandings with food allergies. And hopefully today we can kind of clear up some of that confusion.
How do you best describe what a food allergy is to a patient?
Well, a food allergy is an adverse reaction that someone experiences reproducibly when they eat a food. And the key is that it's caused by an immune reaction. So basically the immune system is causing a hypersensitivity reaction to that food. It recognizes the food is dangerous, and it causes a reaction that leads to symptoms for that patient.
And we're going to go over the list of symptoms, but I found something interesting that you recently told me was that food allergies are on the rise and they've been increasing over as far as the number of cases in recent years. Explain what's the reason behind this, growing prevalence.
Okay. Well, there's a lot of different ideas behind this, and one of the leading ideas is something we call the hygiene hypothesis. So the hygiene hypothesis states that in today's industrialized society, there's a lot better food storage, better sanitation, we have more vaccines and better antibiotics, and so people aren't having to fight as many infections or as difficult of infections. And when our immune system isn't busy fighting those infections, it tends to develop more allergies instead.
There is a list of the most common food allergies. Oftentimes, I know that when I think of food allergies, peanuts and shellfish kind of come to mind, but there's more to that list. Let's go over that. Talk about the most common food allergies.
Well, first off, with adults, the peanuts, tree nuts, fish, and shellfish are going to be the most common things people are allergic to. When we look at younger children, it's wheat, eggs, milk, peanut, soy, and tree nuts.
Why is that? Do we understand why there are additional food allergies for children that you don't really see in adults?
Well, with children, a lot of times those food allergies can be outgrown, but the foods that we're talking about in adults, those fish, shellfish, peanuts, tree nuts, they're ones that are less likely to go away, and so we find that those kind of persist throughout life.
So what exactly causes an allergy to a certain food?
Okay, well, when we're talking about food allergies to particular foods, we find that most of the time food allergies develop to the protein part of the food. And when we're talking about food allergies, the most common type of food allergy and most concerning is an immediate type of food allergy reaction, which are caused by these IgE antibodies. And these are the allergic type of antibodies that can trigger a reaction in the patient. And so certain foods just appear to be more allergenic and are recognized by the body as foreign. And those are the foods that we've listed for you here.
Well, and the peanut allergy seems to be one of the most serious forms of allergies. I mean, you hear about cases of people who are so sensitive that if they're on an airplane and someone opens a bag of peanuts, then they could, break into hives and not be able to breathe. Walk me through why someone has such a dangerous reaction to such a tiny little nut.
Okay. Well, we know that about over 150 people die every year in the United States from food allergy reactions.
Wow.
And a lot of those, a majority in the studies we've seen, are due to peanuts or tree nuts. And we think, again, it's because of the allergenicity of that protein. So the nut proteins just are recognized more forcibly by the immune system and can trigger that chain of events that leads to the allergic reaction. Also, with nut proteins, they're a little more stable. So when they're cooked or when we digest them in our body, we're not digesting them as much as some other like fresh fruits and vegetables. And so the protein gets absorbed without being broken down, and it can trigger that reaction. And it can cause what's called anaphylaxis, where even the smallest amount of food can trigger the immune system to have a full-blown reaction, which can be life-threatening within minutes.
I know that we showed our viewers just a few minutes ago the list of the most common food allergies, but are there other types of food allergies that you've diagnosed that people should know about?
Yeah, well, really, Angela, almost any food can cause a food allergy reaction. but these are the most common ones. There's some more unusual ones that I've diagnosed before. I saw a child with a pumpkin allergy. I saw a gentleman who was having allergies to the barley in his beer. Another guy who was having a food allergy to the silkworm larva that he was eating. So all sorts of types of reactions.
Wow, yeah, that is interesting. Well, let's go over the signs and the symptoms now of when someone might be allergic to a certain type of food.
Okay. Well, when we're talking about food allergies, these immediate type of food allergy reactions, first off, we need to realize that a key to the history is that the reaction typically starts within minutes. So within several minutes, quickly after eating the food, or definitely within an hour or two. And it should happen once they've developed that food allergy within it should continue to happen each time they eat it. So the specific symptoms that can happen depend on which body system is involved. So if it is the skin, which is the most common, they can develop redness, itching, hives, swelling. If it's the respiratory system, they can have itchy eyes and nose. They can have coughing, tingling in the throat, breathing problems. If it's in the GI tract, nausea, vomiting, diarrhea, or in the cardiovascular, they can have low blood pressure or even passing out.
So as far as all of these symptoms, a patient would experience one or two, not necessarily all of these all at one time?
Typically, they won't experience all these symptoms, so it can be a combination of these different symptoms. And unfortunately, we can't predict based on what their prior reaction was, what their future reaction is going to be. So it can be more significant or more life-threatening the next time.
If, let's say, you're an adult and you experience one of these types of symptoms, but one that's, obviously like throat tightening and trouble breathing, that's extremely serious, and you need to go and seek medical care for that. But if it is something a little more mild, what should a person do about that? Should they just say, well, okay, I experienced that and I'm just going to avoid that food? Or should they seek out an allergist to really make sure that they're actually allergic to that food?
Yeah, I think that, as we talked about, 1 in 3 people think they're allergic to a food, and so they may be unnecessarily avoiding those foods, when in reality the ratios are a lot smaller. So you really want to make sure that you figure out, is it a food allergy? Because if it is, you could be at risk of having a life-threatening reaction the next time you eat it. So you really, and it's difficult to diagnose sometimes, so you are best to seek out someone who has experience with treating and diagnosing food allergies. An allergist immunologist is someone who's spent extensive time in fellowship learning how to diagnose and manage different types of allergies like food allergies.
Well, sometimes when a food allergy is suspected, it turns out to be something else called food intolerance. Explain what that is and why it is oftentimes confused for food allergy at first.
Sure. Well, they're actually more common than food allergies, and people can have all sorts of adverse reactions or symptoms after eating a food. And they're not oftentimes a food allergy. And it's a key distinction, because a food allergy, as we said, can cause a life-threatening reaction within minutes of exposure to just a small amount of food. These other food intolerances, there can be a variety of different things that can cause food intolerances. Things like when some people are more sensitive to caffeine and they may get jittery, or with food poisoning, they may have an adverse reaction. Lactose intolerance, when they have bloating and gassiness with dairy products. So a whole host of things can cause adverse food reactions.
Explain what a cross-reactive food allergy is.
Well, when somebody is allergic to a particular food, such as a tree nut, for instance, the proteins can be very similar between the different tree nuts, so they may be at higher risk of having a reaction to any of the other tree nuts. Similarly, when they're allergic to one shellfish, like shrimp, they may be more likely to have a reaction to crab or lobster. There's another interesting entity called the oral allergy syndrome. And this occurs in people who have hay fever or allergic rhinitis type of symptoms to different pollens. And there are some cross-reactive proteins in some fresh fruits and vegetables that those people can then experience symptoms when they eat those foods. And so they eat the fresh fruit or vegetable, they may get some tingling or itching in their mouth. And what's interesting is if those foods are cooked, it usually breaks down the protein and they no longer have those symptoms.
Well, and for example, someone might have that tingling or itchy sensation if they eat an apple and it still has the skin on it, but that would be because they're allergic to birch pollen? Is that
right.
correct?
With birch pollen, there's several foods that are known to be cross-reactive, like apple, cherry, peach. Another one that's well known is with ragweed. People who are allergic to ragweed can have symptoms with a variety of melons or bananas.
And I guess the most common melon would be the cantaloupe for that particular one. Well, now let's talk about how do you diagnose a food allergy, because there are several ways you can go about confirming whether the suspicions are true of food allergy.
Right. And this is real important here, and it can be quite difficult. First off, we need to, again, remind everybody that with a food allergy, immediate type food allergy, the key is that the history is consistent. So the patient repeatedly has reactions on exposure to that food, and it happens relatively quickly, and it comprises of those symptoms that we already went through. Now, if that's concerning, then we pursue some food allergy testing. And one of the quickest and least expensive ways that can be done easily in the office is something called a food allergy skin test. And so a small drop of that food is placed on the patient's skin, and then a little pricking device is used just to introduce it into the skin surface. 15, 20 minutes later, then we can come back and take a look and see if they have a reaction. And if that patient has the allergic type of IgE antibodies in their system, they'll develop a little swelling and redness, and we can grade that reaction and have a likelihood of how likely it is they're allergic to that food. Another type of testing that can be done is something called a blood allergy test, where we look for those specific IgE antibodies in the blood. It's not quite as sensitive as a skin test, but it can be helpful when used in combination. Now, unfortunately, neither of these tests are perfect at this point, and so there can be what we call false positive results, where a patient can eat, say, peanut butter sandwich every day, but their tests would come back positive. And they're obviously not allergic because they can tolerate it. Yeah. But it could, and because of that, we don't recommend doing these allergy testing to large panels of foods as a screening, because you'll often pick up foods falsely positive and may unnecessarily tell people to avoid those foods.
That's interesting.
So they need to be just done, catered towards the foods that are concerning by the history. On the other hand, sometimes both these tests don't always pick up the food allergy. So a patient who has a history of problems after peanuts may be negative on both these tests. And if there still is a concern, the most definitive test we do is called an oral food challenge, where we bring them into clinic and we gradually allow them to eat increasing amounts of that food to see whether or not they truly are allergic to that food.
Interesting. Well, once you confirm that there is a food allergy, what's the next step as far as treatment?
Yeah. Well, there's several things, and this is where it's very important. First off, the patient needs to have extensive education on learning how to avoid coming in contact with this food. And they need to learn how to read labels of all the foods that they're eating and look for those ingredients of the food they're allergic to. The other things that, and there's great resources out there. There's something called the Food Allergy and Anaphylaxis Network at foodallergy.org they can look at. Our practice website, charlestonallergy.com, has other links to other great resources they can look at. The other things, when we're talking about treatment, the best treatment and most reliable is something called epinephrine. Epinephrine is similar to a natural hormone in our body called adrenaline, and that can stop the allergic reaction and reverse the signs and symptoms of it. Studies have found that the longer you wait to give epinephrine with a food allergy reaction, or if it's not given, the more likely someone may die from that reaction.
This is obviously for the very severe cases, right?
Well, the problem with food allergy reactions is that they can progress on relatively rapidly. So if it's a patient that we know has a food allergy reaction, a systemic one, and they have a combination of some of those symptoms we already discussed after eating that food, the safest thing to do is to use that EpiPen and then seek immediate medical attention.
Okay. And you have an EpiPen with you. Explain real quickly when someone uses it and how it's used.
Well, this is something we give to our patients that they should have at home, so that if they have a reaction, they can treat themselves and then get in and get seen immediately. It's a relatively easy thing. We recommend patients hold it in their hand with their thumb over their fingers. You take off the safety cap off the back, and then the orange part goes into your upper outer thigh and can go through clothes. But again, if they ever use it, they need to get straight on in, because it may not be enough medicine, or it may wear off over time.
Well, we've gone over a lot of information today about food allergies. What's your bottom line message for viewers? What's that single most important thing that you want people to take home from our conversation?
Well, I think as we discussed, food allergies are life-threatening, and they can really impair quality of life. On the same token, there's a lot of people out there that are avoiding foods they think they're allergic to that they really aren't. So I'd say if anybody's worried about having a food allergy, the best recommendation is to get in and see somebody who is experienced at diagnosing and treating food allergies, such as a board-certified allergist.
All right, sounds good. Thank you so much for being here and talking about this topic. And if you at home still have more questions about food allergies for Dr. Dietrich, then all you have to do is pick up the phone and call 402-CARE. That number is 402-2273. As always, thank you for watching Health Beat, your source for health and wellness information, exclusively on Comcast C2 and sponsored by Roper St. Francis Healthcare. Have a terrific day.